Good evening and welcome. My name is Gary Morrison and I am the co-convener of tonight's webinar and also part of the management group for the LGBTQIA+ Shine a Light group. Welcome to our webinar series for 2023. Before we go any further, I'd like to do a welcome to country. I'd like to acknowledge the traditional custodians of the Aurora Nation that I'm speaking to you from this evening here in Sydney. I also acknowledge the traditional custodians of the lands on each of you where you're living. As we share our knowledge, may we also pay respect to our elders, both past and present, as it is their knowledge and their experiences that holds the key to the success of future generations. Thank you. Welcome, as I said earlier, and this is our third webinar for our series this year. It's entitled Integrative Oncology, Living Well with Prostate Cancer. Before I go any further, I'd like to welcome our sponsors, Boston Scientific and also PCFA, who have provided us with enormous support in being able to bring this webinar series to you. That being said, I'd also like to welcome our speakers this evening, Associate Professor Judith Lacy and also Emma Wong. I'll leave it to Kalli Spencer, who's my co-chair, to introduce them more formally in just a moment. The topic tonight is one which in our group, we have a fairly large group which covers all of Australia, which is a theme around those that are having a clinical treatment pathway of oncology, how they're living and how they're surviving undergoing treatment. It was a subject which we've had numerous discussions on within our support group, and I know that tonight you'll be able to hear expert opinion from both Judith and from Emma. These webinars are designed for you to be able to participate throughout the whole 2-hour process. I encourage you that if you've got questions, whatever they may be, simply type them into the question portal and we'll be able to get those addressed as we're continuing through the webinar. We're not going to hold questions back to the very end. We will be funneling questions through to the speakers throughout the webinar. That being said, again, welcome to you all, and I'll hand over to Kalli Spencer, who is my co-chair for the rest of the session.
Thanks, Gary. Thanks for the introduction. Yeah, it's, you know, in medicine, there's always sort of been this great divide between allopathic medicine and complementary alternative medicine. And it's so refreshing to see that a whole speciality has emerged where we can actually fuse these two areas of medicine together. And that's exactly what we're going to hear about this evening from our two esteemed speakers. So let me jump straight into introducing them both. I'll start with Professor Judith Lacy, who will speak first. And she is the head of supportive care and integrative oncology at the Chris O'Brien Lifehouse. Her primary interest is in the development and integration of supportive care interventions that include complementary therapies and integrative medicine to keep people living well with cancer, independent of prognosis or the stage of disease. And her focus is in whole person care and works with other practitioners to maximize patient well-being. Her research interests and activities are in the field of integrative oncology, medicinal cannabis, and supportive care service development. She holds key leadership positions in the field of integrative oncology, supportive cancer care, and medicinal cannabis, and is involved in research, teaching, and service development at the local, national, and international level. She is affiliated to University of Sydney and the Western Sydney University, as well as being the national chair for the Clinical Oncology Association of Australia, as well as a board member for the Clinical Practice Group. So we're in very good company this evening, and I'm going to hand over to Associate Professor Judith Lacy.
Hello, everybody. I'm going to, and thank you very much, Kalli and Gary, for the introduction, and it's quite an honour to be speaking with you today. This is, I actually don't speak that much about prostate cancer. I speak a lot about integrative oncology and supportive cancer care, quite a lot about medicinal cannabis, so it's quite it's been quite good actually having an opportunity to speak to men who use our services less than women at the moment about integrative oncology, what it means, and how we really look at ways of treating the whole person in cancer care, and what the role of some of these opportunities and therapies have. Emma and I just came back from the Society for Integrative Oncology conference in Banff in Canada. It was absolutely beautiful. I haven't even spoken to Emma about her trip and her trekking around, but we'll catch up later when we're at work together. But this was a gathering of a few hundred people from over 40 countries, all working in integrative oncology. And one of the keynote speakers was actually a guy called Donald Abrams, who's a very well-known medical oncologist, started his work in HIV medicine, went on to work in oncology, and really headed and was one of the first medical oncologists to go into this field of integrative oncology, and with a particular interest in prostate cancer. So I'm trying to channel his wisdom as I speak to you today. A little bit of background of where integrative oncology is at the moment, and I guess we're very fortunate at Chris O'Brien Lifehouse to have the most comprehensive integrative oncology service in Australia at the moment, with medical specialists, nurse practitioners. We run a survivorship program. We have a very busy exercise program, which includes 2 men-only programs for prostate cancer patients that have been developed and becoming far more popular thanks to support from some of the drug companies as well, to really promote the importance of exercise in prostate cancer survivorship and well-being. The oncology massage therapists, we have acupuncturists, and you'll hear a lot more about acupuncture today. So I'm actually not going to speak much about acupuncture, only to say it's one of the most amazing therapies, I think, for many symptoms for men with prostate cancer. Yoga therapists, mindfulness meditation programs, lymphedema therapists, reflexology, research, and we can't do it without close collaboration with everybody else in the department. And so we see just over 1,000 people coming through a month, and so it's quite busy, and we're really fortunate to have the support to be able to develop this service. So I'll jump right in here and talk a little bit about prostate cancer. From my perspective, I'm not going to talk about the treatments of prostate cancer, the diagnosis. I'm assuming you all have had other talks in that area. I'm really going to focus on wellness and well-being and strategies to integrate complementary therapies and wellness strategies into your care. When we look at prostate cancer, it's really becoming more and more obvious that the causes are multifactorial, that it's a complex disease, and it involves numerous genetic factors as well as environmental and physiological factors that often will be associated with the development of prostate cancer. There's a lot we obviously still don't know, but we know there's something to do with family history, age, diet, ethnicity, potential previous infections. We're also becoming more interested over the last decades on the crucial role of our own innate immune systems and the impact of environment. So looking at the microbiome, which I'll speak a little bit about, and how we can modify our own immune systems through exercise, diet, and lifestyle change to not just improve our well-being, but also potentially change outcomes. And so this really has led to this growth of this field called integrative oncology. So I thought I'd just include the definition of integrative oncology. It's quite a new term. This is the definition that was developed by a Delphi process and published in the JNCI journal monographs back in 2017, and it was a global collaborative that developed this definition, and this is the definition we use in our integrative oncology programs, and as the integrative oncology lead at the moment for the Clinical Oncology Society of Australia, they've accepted this definition as well, which is great. And integrative oncology is a patient-centered, evidence-informed field of cancer care. And this utilizes mind and body practices, natural products, and or lifestyle modifications, and I would say definitely lifestyle modifications from different traditions. And this is alongside, and not instead of, but alongside conventional cancer treatments. And so it's to complement the therapies. And integrative oncology aims to optimize the health, the quality of life, and the clinical outcomes across the cancer continuum. And the aim is to empower people, not just to both to prevent their cancer, but also to become really active participants in their own care before cancer develops, during, and also beyond cancer treatments. And people are living a lot longer with a cancer diagnosis, with a diagnosis of advanced cancer, but also living a lot longer after an acute cancer treatment, and managing their well-being and continuing is all part of integrative oncology. So it's quite a big field. When we look at the key time points for integrative oncology and supportive care interventions, everybody presents, and everybody has presents at different stages. They have different concerns, and it's really to meet somebody where they are at the moment. So if we're meeting somebody at diagnosis, we might be talking about the cancer, the treatment related, the impact of the cancer on their psychological and physical well-being, the impact on their treatment, on their psychological and physical well-being, the impact on their family and their loved ones, and you know, decision making at around that stage. Many people with prostate cancer actually, it's a sort of that watch and wait space of surveillance. Oh, we'll just keep measuring your PSA regularly, or give you treatment and monitor. And how do we assist people during this surveillance space, that watch and wait space? And it's quite unique actually to prostate cancer, unique in some blood cancers, but it's not a common management. It's quite a difficult space for many people to sit in. During treatment itself, we're then looking at the impact of the actual treatments on people. People increasingly are receiving not only hormone treatment, radiotherapy, surgery, but then also chemotherapy, targeted treatments. And the more advanced cancer therapies become, the more personalized they become, and the more targets. And so the side effects vary, but some of those side effects from treatments may be joint pain, arthralgia, myalgia, muscle pain, other pain symptoms, anorexia, loss of appetite, nausea, sleep issues, anxiety, and that obviously is dependent on the treatment people are receiving. And then you slip it, then you go into this, okay, this survivorship space. How do you live with advanced cancer? What is survivorship? It's living with or after a cancer diagnosis. And then common symptoms may be, if you're still living on hormone therapy, hot flushes, the ongoing sleep disturbances, potential chronic joint pain, chronic pain, ongoing anxiety, fear of recurrence, and other things that come up for people. And then people with advanced cancer and progressive disease, or dying from other causes, or having progression from other diseases, what issues then come up for those people, and how do you manage them, and how do you develop a treatment plan for each person? And so it's quite a big brief, isn't it? So it's much easier, I think, just focusing on, you know, being the shoulder expert, the orthopedic surgeon that just does shoulders. And for this space, we need to really understand the whole person and the impact, and also understand what we can do. And so that's where, to work in this field, we're really working to really understand what's going on with the tumor, staying up to date with the knowledge of the cancers, the treatments, the side effects, and trying and developing different approaches for different cancers and different people. Knowing the side effects of the treatments themselves. And as you know, as treatments change, new side effects, new combination treatments, new different and side effects, and staying up to speed and looking at how we can best manage those symptoms. And we become experts in symptom management and looking outside of the box, which is that this end box here, which is the focus of the talk today, which is the complementary and integrative medicine modalities or interventions, which will include. Yes.
Oh, sorry, Judith. I just want to add, someone also mentioned, side effects could also include sexual function side effects, particularly related to prostate cancer.
Absolutely. And I'm leaving that to Emma to talk about, because that's the topic of her entire PhD. So, but definitely, I think sexual health is very, that's obviously sometimes one of the main side effects that really impact on people's quality of life and their emotional health. And so using the different modalities and understanding what we have in our toolbox to try and manage side effects. And we know that Western medicine and allopathic medicine is quite limited in managing some toxicities, how we expand our toolbox and understand that. And so
before you go on, sorry to keep interrupting, I just want to remind everyone that the Q&A session, if you want to ask questions, there's a Q&A button just to the right of your screen where you can type it in and send us as many questions as you want, and we'll get them answered for you. Please proceed, Judith.
Oh, no, that's great. And Kalli, thank you for just stopping me there. But the next slide did mention sexual health. And I think that when you look at all the symptoms that people develop, we know that it's very rare that you have one symptom in isolation. And it's really listening to the person. We use something called patient-reported outcome measures, where we actually ask people to score what their symptoms are, and look at what symptoms are affecting people and how we can reduce polypharmacy using lots of drugs to treat something, address the impact on the whole person, and trying to get this balance right. And it's all about getting that person back into balance. So if you have sleep disturbances and you've got hot flushes all night and you've got chronic pain and you've got sexual health concerns and you're anxious about what's going to happen next, what's your oncologist going to say tomorrow, how do you function and how can we manage all of those symptoms using non-pharmacological means as well as others? And I'm going to leave I think acupuncture plays a really significant role here, but I'm going to say, think about acupuncture, but also think about, Emma's going to really speak about that from her point of expertise, but also many of these symptoms may be managed with exercise and massage, diet changes, some medications, and a combination of these therapies. Medicinal cannabis obviously plays a role for some people as well. And it's things like medicinal cannabis and acupuncture and our multidisciplinary approach that I think is the real essence of integrative oncology and supportive care. And it's looking at the fact that even though people may be receiving chemotherapy and having side effects from the treatment itself, very rarely does someone have chemotherapy on its own now. It's usually combined with other treatments. And it's not actually just the toxicity of the treatment, but also the implications on the person, the sleep disturbances and other symptoms also related to the disease itself, and working out how we manage that best. And that's really the fun of my work and our work, is that we see the whole person and work together as a team. So I've been a doctor now for 35 years, I think this year, 36 years this year. And so it's been medicine's changed quite a lot, but in the last 8 or 9 years, I've been working really in this space of integrative oncology and looking outside of the standard toolbox that I've had. So when I see a patient, and when somebody in a similar position to me sees a patient, it's a person with a cancer diagnosis. It's stepping back and taking that comprehensive assessment of the whole health condition, not just the disease, not just the organ, not just one component, but looking at the impact of the disease on the person, the treatment on the person, that person's approach and their needs, and how they like to stay well, and developing and looking at the biopsychosocial, social, cultural, and spiritual needs of that person. But what's beautiful is this toolbox, and this is just what's in our toolbox, in our service, and is yoga, exercise, oncology, massage, acupuncture, reflexology, mindfulness, cannabis, diet, herbs and supplements, health coaching, palliative care when it's appropriate, occupational therapy, music therapy. How do you put that together when you've got so much, plus, opioids when they're needed, anti-neuropathic agents when they're needed, and other treatment management? So it's really stepping back and being open-minded, but also looking outside of the box.
Another question, what about Reiki?
So Reiki is, so when we talk about Reiki, I guess I work at a very big comprehensive cancer center. So at the moment, we're not formally offering Reiki, unless we do it as a clinical trial, just because the evidence isn't quite there. And I think that's a really important question. And it's really about this toolbox, which is quite large, and you can see the list of therapies. I would love to have energy therapies included. Many centers do have Reiki. It's a matter of the level of evidence. So if you're looking at evidence-informed and evidence-based interventions, wanting to introduce this as standard of care in a large teaching hospital, how do you do that safely? So I think the best way of introducing Reiki and energy healing for us at the moment is through research, or through as part of, and self-Reiki is really interesting. We're not offering Qigong at the moment. We don't have a great Qigong master that is available to us. We're not offering hypnosis at the moment. There's quite a bit of information there. So opportunities. So the aim of care in this space is to improve the symptom management to that person, just to enable them to thrive, to reduce polypharmacy. People are living longer with cancer. I really, my approach, we've got an opioid epidemic. We don't need people on opioids and benzodiazepines or other drugs unnecessarily if you can manage their symptoms in different ways, and possibly better. Integrate the therapies as part of whole person care plan, engage a person in their own care to enhance their well-being independent of their stage of disease, develop a therapeutic relationship with the person so that you really engage them and learn from them as to how you can work together to find best outcomes for them, and educate people about self-empowerment, self-care. I've wrote this slide. I must have cut and pasted it from a talk I give about cannabis, because I think medicinal cannabis fits very beautifully into this approach to care if it's prescribed as part of whole person care. I mentioned before that I was, there were many great people who I follow and read their work and work together with, and there are a number of very good websites, and I've put some references at the end of my talk, but a few of them which these two slides are from. One is called Cancer Choices. It used to be called Beyond Conventional Cancer Care. It's free to the public, and it looks at and these 7 healing practices are from that, and it looks at the evidence and the level of evidence, and I'll take some, and I'll be going in and out from some slides from that website, looking at how different therapies can help people to live well with prostate cancer. And there's actually a prostate cancer handbook that has been developed that is very good and interactive. And I have to put my hand up and say I am an advisor on the website, but as yet I haven't given much advice. So but it looks at the second slide here is something called the Mix of 6, and this is from Lorenzo Cohen. Lorenzo Cohen put together a book together with his wife Alison Jeffries, and Lorenzo is the the director of integrative medicine and integrative oncology at MD Anderson in the States. And his book is called Anti-Cancer Living. And it's about the mix of 6 and the synergy. And the 6 are moving more, so exercise, managing stress, sleeping well, creating a healing environment, sharing love and support, and eating well. And in the middle, in both of these, is exploring what matters to the person and trying to, and it's really important, this concept of balance and homeostasis, which you'll hear more about. And it's this synergy. How do you help a person to improve their well-being by working on all of these areas, and empowering them to make changes in their lives to live well? The Charles Perkins Centre in Sydney at University of Sydney recently is doing a lot of really interesting work around food and the impact of modifiable risk factors for certain cancers. And I really liked this paper. It was the influence of modifiable factors on breast and prostate cancer risk and disease progression. And it looks at what happened, what's so important about exercise, balanced diet, weight management on cancers. And as you can see, there's the potential that you can reduce inflammation with exercise, you can increase antioxidant defenses with exercise. Your diet impacts the microbiome diversity, and that in tune, we know that a more diverse microbiome, very sweeping statement here, improves your immune response and your immune system. The more diverse, the better your immune function. How do you modify that with diet? What's the impact of certain dietary nutrient substrates on certain cancers, and particularly prostate cancer? The impact of fat and adiposity, particularly on breast cancer, but potentially also on prostate cancer, and the role in estrogen synthesis, and oncology signaling. So as this is being unpacked, what we're seeing here on that green is the impact. We know there's a decreased risk of breast cancer with modifying these risk factors, and a possible but still inconsistent results when it comes to prostate cancer, but it's very much a watch this space. Tumor development, decrease in growth of both prostate and breast cancer with modifying some of these factors through physical activity, diet, and weight management, and improving survival of both cancers and potentially decreasing recurrence. So a lot of work is being done on how we can prevent and modify disease progression through changes of our diet and managing lifestyle factors.
Judith, on that note, we often get asked by patients about cutting out sugar completely from their diet. Some patients also talk about being more alkaline or having more acidity, sort of the pH balance and that effect on cancer. What's your take on both of those issues?
So I'm going to talk a little bit about that. I think the evidence on prostate, so every cancer is different. And so when you're talking about sugars, and this is the impact on sugars on certain cancers, we have more evidence than others. For example, there's not much evidence on the ketogenic diet, which is quite the extreme of cutting out sugars, on prostate cancer, whilst there's more evidence on some obesity-driven cancers such as endometrial cancer, but also particularly brain cancer. But the jury is still out. If you're talking about the Warburg effect and sugars, you're looking at Jenny McClellan's book on how to starve your cancer. Every person with cancer should be off sugars, and taking berberine and metformin, and the challenge is, are all cancers driven by the same mechanism? And I think there's a bit more uncertainty with prostate cancer compared to, say, breast cancer and other cancers. So there's no harm in cutting out refined sugars and refined and hopefully we'll have more evidence to support that a little bit better. So you asked me about sugars and I can't remember the second one.
The pH.
Oh, alkaline diet. I don't know enough about the alkaline diet to comment on that.
Well, maybe not a diet, but just being more alkaline. I don't know if I've heard people speak of that.
Yeah, and I'm really happy to read more about that and to find some more references on the alkaline diet, but it's not something that I talk a lot about in my practice and have found a lot of literature on. And when we're looking at, and when I was looking through the prostate cancer literature, there was very little on the alkaline, alkalizing diet, alkalizing water in that space. I think this is a really good reference. I mentioned this handbook, and you could actually go into the search on cancer choices and put in alkaline diet and prostate cancer, and they'll give you the studies on that. The other good reference to do that, there's quite a few actually, there is Memorial Sloan Kettering about herbs, but they've also started introducing some, for looking up herbs, it's fantastic, but also for looking up some dietary changes. The handbook actually breaks down and this is the approach to prostate cancer based on where you're at the moment, so it's not overwhelming. So it starts with an introduction, then preparing for prostate cancer treatment, then during treatment, surviving and thriving at the time of your treatment and the cancer experience, so that you can look at, oh, what about taking turmeric now? You know, it really depends. So there was a recent presentation at our conference on a study using mistletoe for men with prostate cancer receiving docetaxel, and another study looking at using IV intravenous vitamin C for those patients. And the way the study was designed, it didn't show a benefit and actually showed, but perhaps it's the study design. So there's limitation to our evidence based on, and our recommendations based on the studies that are conducted. So if we just start looking at food, and this is from Gio Espinosa, and I don't know if any of you have heard of Gio Espinosa. He's a naturopathic doctor in the States. He has a whole YouTube channel just talking about prostate cancer and prostate health and sexual health from a naturopathic standpoint, and has written a book on thriving with prostate cancer. And I've taken little excerpts from one of his talks, and I know that's probably less ethical, but I am referring to him, but I just thought it was so beautifully put together, I would share that and acknowledge his work. The first is when you're looking at somebody who has low risk prostate cancer, and what can you do in your diet that is with a goal to reduce the risk of prostate cancer progression or preventing it from ever progressing. And I think this also applies to those people in their watch and wait space, which is sometimes a difficult space. And so there were a few studies in this group, but particularly there was a randomized control trial in men who had an increased vegetable intake that did not, and showed that it didn't reduce the risk of prostate cancer. And that was published in JAMA, but those on a Mediterranean diet was protective among men who had a Gleason score above 6. So that was, contradictory data, was it, wasn't it? Another study, so everyone's looking at what diet changes you can make that can reduce your risk of progression. There was a prospective study published in, I'm not quite sure what year that was published, 2019, on a plant-based diet that may lower the risk of the Gleason grade, but it wasn't definitive. and that substituting 10% of your energy intake from carbohydrates to vegetable fat could also reduce your risk of developing lethal prostate cancer by close to 30%. And that was a paper about 10 years ago now. And so the conclusions and the summary from that and the extrapolation, which is how Cancer Choices and others would then present it, is in order to lower the risk of prostate cancer among people, you can recommend eating more cruciferous vegetables, so from the broccoli family, and there was quite a large study about broccoli and cancer, that yellow orange vegetables or legumes had modest evidence to suggest it may lower your risk of prostate cancer development or progression, that people with higher serum concentrations of enterolactone, which is a metabolite of plant ligands and lignans, and I'm useless with this plant lignan place, so don't ask me about what the details of that. There's modest evidence to suggest certain foods will give you better outcomes, and high intake of total vegetables with quercetin and lignan precursors in their food is suggesting you may get a better lower your risk of progression with early prostate cancer. Andrew Wheel, or I don't know if people know of Dr. Andrew Wheel, and please keep me to time, Kalli. Andrew Wheel is he was probably one of the first. He runs the integrative medicine program. He's now 82, so he's actually retiring from running the integrative medicine program at Arizona University. He's also known as one of the mushroom gurus of medicinal mushrooms in the world, and was one of the first authors of the books on integrative oncology. His focus is very much on what we eat and the importance of food versus supplements, and looking at how you can use diet as a therapeutic intervention in integrative medicine. And so this is his anti-inflammatory food pyramid, which is very much summarizes the diet that I would usually recommend in people with prostate cancer, which is a lot of cruciferous vegetables, so anything with a cross in it, the things that your mum sticks on your plate and you really didn't want to ever eat, or your dad puts on your plate, your broccoli, your Brussels sprouts, but also brightly colored fruit and vegetables, sweet potato, fruits, particularly, again, the antioxidant rich fruits and vegetables like berries, your whole grains, healthy fats, fish and shellfish that are very high in omega-3, grains that are high in omega-6, hemp seed is an example of that, soy-containing foods, cooked Asian, really looking at the Asian mushrooms. I'll talk a little bit more about mushrooms, looking at other sources of protein other than meat, and if it is meat, then it should be lean. It's actually a paper published looking at the impact of poultry fat and too many eggs on prostate cancer, and saying reduce your eggs and your fatty meat fats when you have prostate cancer. The anti-inflammatory benefit of certain herbs and supplements like turmeric, chili, ginger. And then this is very much a pyramid. So at the top, you can see there's a little bit of dark chocolate and a bit of red wine, which is good. And supplements. So you only supplement what you need to supplement rather than taking 50 supplements a day. And generally, when you're looking at the risk of cancer and the benefit of diet, there are these very much overarching statements about fermented dairy, fermented foods, looking at the microbiome and probiotic foods, lower cancer risk among people on anti-inflammatory diet in general. A lot of those studies have been done in breast cancer patients and some in prostate cancer patients and colorectal cancer patients, low risk with eating high levels of olive oil, eating mushrooms, and there are so many medicinal mushroom products out now that I thought I'll touch on a few of them. A high risk of cancer about people who drink sweet, sugary beverages, and a higher risk among people who eat ultra-processed foods and pastries and sweetened foods and preservative-containing meats.
Judith, I just want to interrupt and remind everyone, please, to send through questions. This question chat has been a little bit quiet, so post your questions. We always get asked. I'm surprised. There's always, tomato skins and grapeseed oil, and we always get asked about these things. So everyone out there, if you have any questions you wanted to ask about this, please ask now. Thank you.
And so I mentioned these higher foods, and there was an interesting paper, and I think it's the Reisman paper from 2013 about don't eat too many eggs, and there's a high risk of fatal prostate cancer, but no evidence of the effect on risk overall for prostate cancer among people eating eating more eggs than others, which is quite interesting, very specific, I thought. So I'm going to jump to, and this is a bit of just an overview really, to the gut microbiome and prostate cancer. And the gut microbiome is so sexy at the moment. I'm a little bit obsessed with the gut microbiome. I test all my cancer patients' microbiome and suggest modifying their diet according to their own microbiome. So you're really personalizing your immune system and what the impact of food on your immune system based on your own gut. What we do know is that there is the more we learn about the gut microbiome, the more we learn about the microbiome of the bladder, of the prostate, of the breast, of the lungs, of the esophagus, of the oral cavity, the more we're seeing this connection between the microbiome of the gut, where the bacteria that live in your gut, but also bacteria that live in different organs around your body and their relationship to developing different cancers. And so this is currently being unpacked. So it's really a watch this space. The factors that affect your gut microbiome, and we're trying to unpack why so many young people and people in the Western diet is really changing the incidence of cancer as well. So what is it that you eat? Is it fast foods that really mess up your gut? Obesity, stress. I mean, people who get stress, who have, the classic is the person with irritable bowel disease, always get diarrhea when they're stressed. And so that impact of stress on cancer is really interesting. And if you're unpacking it and saying, actually, it could be the impact of stress on your gut microbiome, on your immune system, and the development of cancer that may have been laying dormant, but various environmental factors are having a greater influence. And then the genetics themselves and how you can potentially modify your gut microbiome. People are looking at, as immunotherapy is becoming more popular, people looking at the impact of fecal transplants. And we know that people have a better response to immunotherapy in certain cancer groups when they have a more diverse gut microbiome.
I wanted to interrupt Judith with my personal opinion. I wonder, other than what you just mentioned, what about the preservatives that go into food? How is it that our bread lasts for so long and fruit lasts for so long? In years gone by, things would never last that long. Why do they look so shiny and good? Why do they taste so good? What are all the chemicals that are being put in, the preservatives that we don't know about? And what is their impact on cancer formation?
No, and Lorenzo Cohen has done a lot of work in that space, and it's quite a decent chapter in his Anti-Cancer Living book, looking at the impact of plastics on and wrapping of, you get of many of our foods, and putting stuff in the microwave wrapped in horrible plastics on the incidence of cancer. So there's a lot there, isn't there? So I'm going to come back to diet and diet supplements, but I need to just segue quickly to the fact that exercise is really medicine. And when you're thinking about what can you do that's going to shift your outcome, improve your symptom management, and potentially improve your gut health, your immune system, your sleep, your stress, your symptom management. It's exercise. People with bone disease, people on hormone therapy, exercise is extremely important for those people. And when we're looking at the impact of hormone therapy on bone health, exercise is really crucial. And so that's the reason we're running so many programs for prostate cancer patients. People can live with metastatic prostate cancer with bone disease for a very, very long time, but good bone health improves your function and your quality of life. So, and exercise enables you to have good bone health. So exercise lowers the risk of prostate cancer among people with higher levels of activity. There's preliminary evidence to say they have reduced risk of prostate cancer. There's a low risk of cancer diagnosis about people generally with people that exercise. The goal in people with low risk prostate cancer and exercise is really to prevent progression and to reduce development of other chronic diseases. And high intensity training has been associated with decreased PSA levels and the velocity of rise of PSA. So including high intensity training as well as weight training has been shown to be beneficial. And so there was a study published in 2015 that they followed men for 20 years and found that vigorous exercise and other healthy lifestyle habits reduced lethal types of prostate cancer in up to 68%, which is a very high number. There has been some work on selected herbs and supplements for early prostate cancer and generally for prostate cancer. And this, I thought I'd take a snapshot of one of the pages from the Cancer Choices, not that I'm advertising, I'm just saying it's quite good. The Cancer Choices pages from the on melatonin. Melatonin is a naturally occurring substance in your body. It helps regulate your sleep and your circadian rhythm. And sleep disturbance, particularly people on hormone therapy and having hot flushes, is one of the most common symptoms that people complain of. So it's one of the natural products that you can take that may help your sleep, but added to that, it may have an anti-proliferative, anti-cancer benefit, and it may actually improve outcomes. And there are some people that are taking, there have been a few studies looking at high dose melatonin, so 20 milligrams a day. There are some naturopaths in Sydney prescribing 60 milligrams a day with some, but I'm not quite comfortable with that high dose. I prescribe 2 to 4 milligrams a day to people. But looking at, this is the level of evidence, it's rated after 5 for melatonin in prostate cancer, for improving treatment outcomes, optimizing your body terrain, managing side effects, reducing cancer risk. So it's a really interesting space, and there has been quite a bit of work on melatonin for prostate cancer. But there are other herbs that may also be beneficial, such as green tea, pomegranate, turmeric, and of course, broccoli, not just as a food, but also as a concentrated herb. When you take any supplements, and prostate cancer treatment being so diverse, the risk of interactions with your chemotherapy, so for example, if you're on docetaxel or any other therapeutic regime, if you're on a clinical trial, you need to be really careful about the interaction and the risk of any herb and supplement, and reishi mushroom is another example of that, and its potential interactions to make the treatment less effective or more toxic. So the pharmacokinetic and also what's called the pharmacodynamic effects of certain herbs and supplements. So some supplements may impact on your liver function or people may stop the anti-cancer treatment if you're taking a herb or a supplement that may actually be impacting on your liver function. That's just an example. Turmeric, it can impact on your ability for your blood to clot. And so if you're on a medication that lowers your platelet count, you need to be careful taking certain supplements. And that includes the medicinal mushrooms, which are very interesting and as immune modulators, working not just on your gut microbiome, but also potentially on your natural killer cells. And so, and improving your quality of life. So there's no evidence at the moment at this stage of the effect of prostate on your PSA among men with prostate cancer treated with reishi mushroom, but improved well-being has been suggested. And so people are using these mushrooms to improve their sense of well-being and energy. So there's
Judith, how are these the same or similar to the recreational mushrooms with psychedelic effects?
Oh, wouldn't that be good? And they're in every supermarket. No. So the psychedelics are psilocybin, aren't they? And have psilocybin in them. So Chinese medicine has been using mushrooms for centuries. Mushrooms are very much, and Emma might be able to speak a little bit more to that, but a lot of Chinese medicine has used mushrooms as part of their anti-cancer treatments and their treatments for many diseases. But it is the interest in the medicinal qualities and nutritional qualities of mushrooms that is increasingly being studied as their medicinal effects, but they don't make you see really interesting things. We'll be doing research in psilocybin soon, so we'll give you some more information about that. But that's a whole other talk. I can talk about psilocybin. Turkey tail is the most studied of the mushrooms, and mainly again in breast cancer, but also in prostate cancer. And there's slightly better survival on people with cancer generally taking turkey tail. It has been the most studied. It interacts less with many other treatments. And if you are taking it, I would look at the work of Paul Stamets and some of the other mushroom people as to whether you want, as you're looking at the turkey tail supplements that are mainly fruit body versus the mycelium. Paul Stamets, who's the mushroom guy, he did that great film called Fantastic Fungi. Very much talked about the nutrition and the benefit being in not just the fruit body, but the mycelium. So look, you want to have a supplement that's labeled well. Vitamin D is increasingly also becoming very popular. I check people's vitamin D levels and try and keep them high. Very important for bone health, but there is an association between lower mortality among people with prostate cancer with higher vitamin D levels, and there's modest evidence to support that. Less progression of PSA in people with higher vitamin D levels. It plays an essential role, and it's very interesting. And the more I'm looking at vitamin D, the less I understand why people often with quite aggressive cancer have very low vitamin D. We see that in breast, in colorectal, and sometimes in prostate cancer as well. And not everybody responds as well to supplementation. It's a fat-soluble vitamin absorbed in the upper gut mainly, and it's from the sun. I am mindful of time, and so I'm going to quickly flick through a few more slides. I spoke about caring for the whole person and that mix of 7 healing practices. One of the very important components of that is managing stress and finding an approach for managing stress that suits you. We know that people who have lower levels of distress seem to have a lower risk of prostate cancer, which is really hard when you say, but I'm the most chilled out person in the world. So is it related to the gut microbiome? What else is happening? Are people who are more distressed sleeping less? Are they not healing as well? Are they eating poorly? It's still being unpacked. But the lower risk of cancer as a whole among people with better stress management and people potentially having less progression who are, when you're managing their stress better, is is an interesting space to be working in. What we do know is if you're less stressed, you feel better and your quality of life is better as well. And so meditation, yoga are really two examples of really useful therapies. And I'm going to touch also then on sleep. I mentioned melatonin, but we also know that sleep is really important. You know, when you talk about sleep, we talk about sleep hygiene, mindfulness, reflexology, acupuncture, oncology, massage, melatonin can all help. Medicinal cannabis has really changed the sleep paradigm as well, and a really interesting, very helpful for people not to get off to sleep, but to have good quality sleep. Limited, of course, by the driving rules, and if you've got THC in your system and you live in Sydney. Magnesium can help, and there are some other relaxing herbs, but getting good quality sleep is pretty essential.
You said living in Sydney, does it mean if you live in another city, then it's fine?
Certain states, yeah, if you live in Tasmania, it's fine. You can drive with cannabis in your system. You can't if you live in New South Wales. So I've touched on, I'm just going to flick through these and different stages of, just to say that different stages of cancer, whether you're post-treatment or pre-treatment, have different levels of evidence because different populations have been studied, but overall exercise is good for you. And there are different foods and different supplements that have been studied in different cancer populations. So the example is the study of actually these button mushrooms, which I used to think, there's not great medicinal properties in the agaricus or the white button mushroom population, but actually, according to this study that was published in Cancer in 2015, that actually the agaricus was associated with declining PSA levels in 36% of patients. So that's another mushroom product, and the properties of mushrooms is used in increasingly used in integrative medicine and in Chinese medicine are significant. And I mentioned broccoli, and there was an interesting fact that a serving of broccoli sprouts is 100 times higher concentration in sulforaphane, which is a word I can never, which is in mature broccoli, but that 60 milligrams of sulforaphane versus placebo increasingly significantly improved the outcomes for prostate cancer patients.
And Judith, is there a difference between whether these mushrooms or vegetables are cooked or whether they're eaten raw?
Yes, so in the recommendation is always cooked.
And cooked how? Steamed or boiled?
Oh, I don't know that one. You know, I tried to cook lion's mane. I did it the other day. I cooked it like halloumi. I don't know if that's how you're supposed to cook it. Emma? Any comments as far as Chinese medicine is concerned?
Generally, with Chinese dietary therapy, we tend to recommend that food is cooked. Sometimes in Chinese dietary therapy, they say that frying food will actually heat the thermal nature of the food. So that's not generally a great thing when it comes to things like prostate cancer. Poaching is often a really good way of cooking food and retaining nutrient, or steaming or blanching. So that way, again, you kind of preparing the food to enter your stomach so that when it drops into your tummy, it's easy to digest, so that you're expending as little amount of energy as possible trying to digest that food, and expending only a small amount of energy to extract the nutrient and turn that nutrient into vitamins and minerals that can be of use to your body. So I definitely agree in terms of a Chinese dietary therapy perspective, it's generally cooked. And with those kind of just gentler methods of cooking is usually what's preferred, keeps it a little bit more neutral and easy to digest.
And I haven't seen, now that I've got you there, Emma, I haven't seen agaricus mentioned very often in medicinal mushroom literature, except for in the prostate cancer space. Do you know much about it?
I actually don't know much about it. In terms of my experience with mushroom, we using the reishi mushroom, but I guess yeah, and I guess in terms of combining with cancer therapy, we kind of got to the point of we just don't combine them because it can be complex. But yeah, my experience would be, yeah, the Ganoderma reishi.
Here's another question. Is it better to have only blended veggies, so done in the NutriBullet, to get the fiber rather than the juices?
I think it really depends on your cancer and the impact of fiber on your system. So some people, generally in a NutriBullet, then you get the whole plant and you get the fiber as well, and the fiber content is really important. But for some people who have had a risk of bowel blockage, they may need to have low fiber diets. So I think it really does depend on the person. So generally I say don't extract the juice, have the whole plant blended.
And the only other thing from a Chinese dietary perspective with blending is lots of people like to add ice and lots of very cold, substances, liquids to their smoothies. And I don't know, in Chinese dietary therapy, we almost like people to have things at room temperature. And that goes for smoothies as well. So you can still add those things, but room temperature is generally a bit easier to digest.
Hanging out with all these Chinese medicine specialists in my practice, I can't have a glass of cold water without being harassed.
No, it should be room temperature or warm. Yes.
I do like cold water, so I think that's because of obviously I'm out of balance. There's also some really interesting papers on red meat and the impact of red meat, and we know in colorectal cancer red meat is a no, particularly if it's grilled. And but there was interesting that there is a few papers on red meat increasing the risk of advanced prostate cancer and this association, as well as with preservative containing food meats, and again, not too many eggs, but the inverse but insignificant association was detected. So the jury's out a little bit about the very specific relationship between these ultra processed meat or these preservative containing meats in prostate cancer, whilst in colorectal cancer and in a few other cancers, it's a definite no. So I'd say don't have, and you can get really good nitrate-free, yummy processed, meats now. Fat consumption is another food comment. So quite a few studies looking at saturated fat intake significantly associated with increased risks of prostate cancer. These are older studies. Vegetables, that only leafy vegetables are found to be protective. But having that plant-based diet, as I mentioned, is protective. And finally, I think there's the those people on ADT and the whole discussion around lycopenes. Do you eat the tomatoes with skin on, skin off question, Kalli? And I guess that's all about lycopene containing foods. And there's a little picture up here of all the different lycopene containing foods. Anything that's really bright red, from my understanding. And in a European study published about 2007, plasma concentrations of lycopenes, higher plasma concentrations associated with, in this study, 60% reduced risk of advanced prostate cancer. I'm not quite sure if that's been repeated or not. And then with people who are on ADT, so on hormone therapy and managing the side effects, acupuncture has a huge role, which Emma will talk more about. The safety of black cohosh comes up. Black cohosh is used a lot in women with hot flushes, not so much with estrogen-containing breast cancers. Very slight risk of liver toxicity with that. Fatigue, the role of ashwagandha, ginseng, cordyceps mushroom. Bone health, the importance of vitamin D, K2, and magnesium, and lion's mane, which is another mushroom, and bacopa, which is quite an interesting herb, and ashwagandha for cognitive and memory disturbance. And so people with advanced cancer obviously have different needs, and we need to address them. But I'd just like to finish, because I would like to leave some time. And you were supposed to keep me on time, and I waffled. But
Enjoying your talk so much, I couldn't stop you.
there are a number of really interesting guidelines that have been published through the association between ASCO, the American Society of Clinical Oncology, and the Society of Integrative Oncology. And they're published in the Journal of Clinical Oncology. One of the papers, one of the studies was the role and looking at the level of evidence to support the use of integrative oncology therapies in managing cancer pain, which was the first guideline. This was published last year. And what you can see is that the studies were mainly, and this is the level of evidence. So the dark blue, the blue is intermediate quality of evidence with moderate strength recommendations. The darker blue is lower quality of evidence, but moderate strength recommendations. And the orange is we don't have quite enough, but it's safe to recommend it. I'm going to point out the aromatase inhibitor-related joint pain, and in women who are on hormone therapy, a lot of them develop joint pain. We're seeing now with people on immunotherapy, they're developing an inflammatory joint pain. Men on hormone therapy will often develop joint pain. And the studies have been done in women with breast cancer, with showing quite a high level of evidence to the point where the recommendation actually says acupuncture should be recommended for women with this joint pain. And the question is whether we can extrapolate that to men with joint pain and chronic joint pain, which often limits their ability to stay on hormone treatment. And so acupuncture is definitely something that I would be recommending, and Emma will speak more about it, as well as yoga for people with joint pain caused by their hormone treatment, or if they've been on paclitaxel or other treatments that causes joint pain. General cancer pain, again, acupuncture and reflexology have been with moderate strength of recommendation, and followed by oncology massage, and the importance of yoga and then guided imagery and relaxation has got decent level of evidence to suggest we can recommend it. Many people receiving chemotherapy will develop peripheral neuropathy, and again, that can be painful, and acupuncture and reflexology can be recommended. People having small procedures, hypnosis is on the rise, and so there's really interest in looking at reducing people who can't tolerate anesthesia as well, hypnosis for putting a port in and different procedures. And so these recommendations are supported, and when you think about what can you suggest to people, these recommendations help us implement these therapies and get these therapies into our hospitals and into our systems. The other guidelines that were published last month were the ASCO, the American Society of Clinical Oncology, and Society for Integrative Oncology guidelines for managing anxiety and depression, and the recommendations and the strength of recommendations for using integrative therapies. And the standout for any adult with cancer experiencing anxiety and also experiencing depression is that of mindfulness. And there's high level evidence to highly recommend and support mindfulness-based interventions, with intermediate evidence suggesting yoga, and again, extrapolating from the breast cancer. Not enough prostate cancer guys go do our yoga studies for us to recommend yoga for prostate cancer. They should, based on the studies for women with breast cancer. Again, relaxation therapies, music therapy, and reflexology. Those on active treatment, lavender and essential oil, and then post-treatment mindfulness, yoga, acupuncture, Tai Chi, reflexology. And these guidelines are available to the public on the ASCO website and free to download, and really happy to talk about them more. I mentioned there were some more resources that I was referring to, and I was trying to channel this superb man, Donald Abrams, who told us his fantastic life story. And really, he started his career in working, being a member of the gay community and working very much with HIV patients, and then going into cancer care, and then focusing on prostate cancer and integrative medicine and medicinal cannabis, and is really a leader in the field. And he has retired, but he hasn't retired for long. He's an advisor on every committee. Gio Espinosa's published a Guide to Living Your Best Life Before and After Prostate Cancer. I haven't read it yet, but I did steal some of his slides. And Cancer Choices, as I mentioned, and Donald Abrams also published on prostate cancer and integrative approach in 2018, due for an update. And with that, I am going to hand over.
Thank you so much, Judith. That was absolutely brilliant. As I said, I just couldn't stop you. So I think we do need to give Emma a chance, though, to speak. I forgot to mention in the beginning of this whole webinar, you know, the other key theme of this webinar was living well with prostate cancer. And I think you exactly encompassed all that in your talk. So that's great. Thank you. And so to tell us more about how you can live well with cancer is Emma Wong, who's a clinical acupuncturist with 18 years experience, 10 of those in oncology acupuncture specifically. She joined the team at Chris O'Brien Lifehouse in 2019, whilst also being an oncology acupuncturist for the Dry July funded program at Western Sydney Integrative Health Medical Centre, providing equitable access to acupuncture treatment for cancer patients from Westmead Public Hospital. Emma is currently completing her PhD to improve quality of life for people with prostate cancer. She's conducting a multi-site randomized control trial at the Chris O'Brien, as well as the SAN Hospital in Sydney, investigating the effects of electroacupuncture for the recovery of sexual function after robotic-assisted radical prostatectomy. She's also conducting a review on how acupuncture can reduce symptom burden for people undergoing treatment with prostate cancer. Emma's research has been inspired by patient and personal experience, and the study designed with early patient advocate input from David and Pam Sandow. She's received multiple grants for her research, and she's also presented some of her findings at some big national and international meetings. So on that note, I hand you over to Emma Wong.
Thank you, Kalli. That was a very generous introduction. So thank you for having me tonight. As you might have kind of gathered from that intro, this topic is a bit of a personal passion of mine. But before we get started, I just wanted to particularly pay acknowledgement to my supervisors, Dr. Suzanne Grant, Professor Henry Wu, Associate Professor Ruben Thanagassalam, Dr. Sean Walsh, and Associate Professor Judith Lacy. And I just needed to acknowledge that I'm a recipient of the Nickham Health Research Institute and Blackmores Institute Scholarship. And this program has funded my study, which is electroacupuncture for a recovery of erectile function after robotic-assisted radical prostatectomy. And I also just, as you mentioned, Kalli, wanted to acknowledge that David and Pam Sandow OAM had some really valuable consumer advocate input into the study design. So we're just making sure that we're really getting the experience of prostate cancer patients and their families into the study design. So before we get started, I just thought you might find it interesting that about 10 years ago, I started to work in acupuncture for cancer care, and particularly for some unknown reason, had a really kind of nice cohort of patients who had had a prostate cancer diagnosis. Some had had surgery, some were going on to have other treatment. And this is how I really got interested in this area. And I found that there was fairly high levels of distress with some of these patients and their families. And I guess I wanted to really see what I could do with acupuncture and electroacupuncture to reduce symptom burden. And really strangely, at this time, a couple of years into this kind of interest area and into me starting to do some research in this area, I had a family member who was diagnosed with prostate cancer, and this family member was young, in early 40s, and after some active surveillance was diagnosed with a pretty aggressive Gleason 9. So it's a 5.4, 5+4 prostate cancer. So no family history, no symptoms, just picked up on a blood test that probably wouldn't have even have been done. And so I guess going through that experience really has shaped my drive to see how we can improve quality of life and reduce symptom burden for patients with prostate cancer. So as I mentioned, my overarching goal of my PhD research is to improve quality of life. And Judith kind of touched on whole person care. And I guess with whole person care, we're talking about, mental, emotional, physical, and spiritual care of patients. With prostate cancer and things like electroacupuncture and acupuncture, we're trying to implement evidence-based protocols. Now, the research in this area is, still emerging. We're still researching. But I guess today I just really wanted to present you my research, but also the other research that's out there that might help anyone who is undergoing or who has completed treatment for prostate cancer. Hopefully I can give you some pointers as to what sorts of things acupuncture and electroacupuncture can be helpful for, what the evidence says, and, give you some guidance as to if you're kind of seeking treatment, what you could perhaps seek treatment for. The benefits of acupuncture and electroacupuncture is that it's non-invasive. It's been shown to be safe. It's non-pharmacological, which Judith touched on, that we can use electroacupuncture and acupuncture safely with other treatments. And the other benefit is that perhaps in reducing some of those side effects from treatment, we can also help you to tolerate treatments for longer. So Judith also touched on this definition, so I won't go through it again. Suffice to say that I think the important take-home message here is that with integrative oncology, we're really trying to optimize health. We're working alongside conventional treatments. So acupuncturists, even though we're we have a professional title, we come under APRA, but we don't treat cancer. So we work alongside conventional treatments and we aim to optimize quality of life and to empower people. I think they're really the take-home messages.
Emma, just a question. Is acupuncture covered by Medicare? Maybe you're still going to get to it. I'm just curious.
Yeah, unfortunately not at this point. I mean, I really think it should be, because in terms of the evidence, acupuncture has one of the highest levels of evidence amongst, these types of therapies. Currently, we're not covered by Medicare. We are covered by private health. But it's been a real work in progress, actually, to try and get acupuncture covered, but currently not, unfortunately.
Thanks. And just a reminder to everyone out there to keep the questions coming. We don't have a lot of time left, so this is your last sort of chance to get those questions in, both for Judith and for Emma. Thank you.
Thanks, Kalli. And so, yeah, I mean, in Chris O'Brien Lifehouse Hospital, we see patients in day therapy, in the wards, and in the consulting rooms. And I guess there is a real shift with prostate cancer treatments to really try and balance best outcomes with optimal quality of life. And this can be across surgery, chemotherapy, radiotherapy, or combinations of treatments. And just referring to the Prostate Cancer Survivorship Essentials framework, acupuncture, I think, and electroacupuncture can really fit quite nicely in terms of potentially having shared management with people like Judith, who head up supportive care and care coordination, using evidence-based interventions, which are emerging for prostate cancer. So just to give you a quick intro to acupuncture, it's part of the system of traditional Chinese medicine. It involves the insertion of single-use pre-sterilized needles. So there's no autoclaving, they're all single-use disposable. And each acupuncture point has a specific point function, and it's in a fixed anatomical location. So every acupuncture point is anatomically measured on each person, and there's 361 of these acupuncture points. It's by nature a holistic system, so and the effects from acupuncture and electroacupuncture are multifactorial. So some of the things we know, some of the mechanisms about acupuncture is it balances sympathetic and parasympathetic nervous system. It can improve blood flow to tissues and muscles, and can activate opioidergic pain receptors and release chemicals like serotonin. So some of the feel-good chemicals from acupuncture. In the hospital, our initial consultation is 60 minutes. It's a thorough session. We go through a full medical history. We discuss your main concerns, and we use patient-reported outcome measures to really get a good gauge on what your main concerns are. And we also use a tongue and pulse examination when we form a diagnosis. We then form a treatment plan, and we then form an individualized treatment. So even though you might present with the same symptom as, you know, the patient before you, your treatment might not be exactly the same. And just to give you an idea, people always ask us, what are you looking at when you look at someone's tongue? So we're looking at different organ systems. We're looking at the tongue topography. What does it look like? What is the coat like? What is the color like? And in the pulse, we're also looking at pulse positions, which reflect organ systems. And we also look at different pulse qualities and rhythms and strength of the pulse. And this all guides us toward a diagnosis which is individualized to you. Treatments in the hospital are 20 minutes duration. We keep it to a lower end of length and dose. And many people ask us, does acupuncture hurt? And we have lots of needle phobic patients, and find that the majority of patients are very tolerant of acupuncture, and we can reduce the dose by using really small needles. And so if this is ever a concern, you should definitely talk to your practitioner. We can usually work around needle phobia. So my research is in two parts, as you mentioned, Kalli. So one part of my research is for patients who have had a radical prostatectomy. And the main side effects from this are erectile dysfunction and urinary incontinence. And just to kind of highlight, I think perhaps sometimes these things are overlooked, or they're too awkward, or they're too tricky to talk about, or for whatever reason. But I think it's worth just mentioning that a significant number of men will suffer from significant changes to their sexual function. And in this study, 85% reported that it persisted for 6 years. So it's a considerable amount of time. And in terms of urinary leakage, 20% reported that it persisted for 6 years. And I guess the important part of this is that this is usually associated with high levels of emotional distress, including depression. So some of the psychosocial challenges that men report are things like shame, embarrassment, loss of masculinity, reduction in general happiness, high levels of low self-esteem, and psychological distress, and anxiety and fear, embarrassment are also reported. And, you know, I thought this was interesting because I think it's said often that it's a small problem. Losing or having changes to sexual function is a small problem. But we know in the research that it's not. It's a significant problem. And so in my research, I'm really trying to address, we have, good survivorship from surgery, but we have at the moment really limited options for recovery of sexual function. And loss of sexual function significantly affects quality of life. So when looking at acupuncture and electroacupuncture, we know that it's safe, we know that it's non-invasive, and we know that it has a holistic approach so that we can look after the whole person in a physical, mental, emotional, and spiritual scope. Now, this is a case report that I published this year. It was from a patient that I actually saw, I think, in 2017. And I was just going to run through a little bit of it, a few of the main sort of take homes from it, because it actually inspired the clinical trial that we're running. So this man was a 71-year-old. He came in to seek treatment with his wife. He was 12 months post a unilateral nerve-sparing robotic-assisted radical prostatectomy. And I did 6 sessions of electroacupuncture over 6 weeks, so 1 session per week. And we noticed that he had some positive changes. So after his second session, he reported that he was able to have a spontaneous erection, which he hadn't previously been able to have. There were no adverse outcome effects reported. The treatment was well tolerated. We also noticed after treatment 4 that he was not only being able to have a spontaneous erection, but he was responding better to Viagra within that 24-hour time frame of having the electroacupuncture. And by the end, he said that he thought, and this is subjective, this is just his report, that he'd had about an 80% improvement. Now, I used patient-reported outcome measures with this patient to see if we could get a gauge on improvement or change. And with the IIEF-5, he started off with moderate, sorry, I can't see my notes to see the actual score of what 12 reflected. Suffice to say that when he got to the end and his IIEF-5 score went to 22, he was then on the cusp of normal function. So I think from memory, he went moderate, mild to on the cusp of normal. So this was just one patient, but it was an interesting outcome, encouraging enough that we decided to then do a study. So we're currently recruiting for this study. As Kalli mentioned, it's a multi-site hospital study at the Sydney Adventist Hospital and Chris O'Brien Lifehouse Hospital. And we are seeing if we can, seeing if electroacupuncture is feasible for a start, and perhaps see if we can get a signal, given that it's on the larger end of a feasibility study in terms of numbers, whether we can get a signal for effect for electroacupuncture. And when we're looking at electroacupuncture for the study, we have 2 groups. So it's a randomized controlled trial. We're looking for participants over 18 within 2 years of surgery. And we're hoping, as I said, to glean some information to perhaps do a larger study of its kind. Now, the interesting things about acupuncture and electroacupuncture for this study is that we've designed it with acupuncture points on their own and also electroacupuncture points. So electroacupuncture is when you connect a small electrical current to the needles, and in the hope that you might be able to regenerate or coax some of those nerves back into function. And the acupuncture points are in there as well, because we know that calming the central nervous system and regulating some of those nerves is really important in the overall recovery of sexual function. So we've got one part of the study is looking at, calming anxiety and treating the whole person, and the electroacupuncture is actually looking at nerve regeneration for recovery of function. And we know that some of the mechanisms of acupuncture, we know from functional MRI that the effects are mediated through the central nervous system. We know that certain regulatory centers of the brain to do with recovery of sexual function can be stimulated with acupuncture. We also know that certain peptides can be stimulated to be released, and that the sympathetic and parasympathetic nervous system can be balanced. And that we can also improve local blood supply to tissues, which is really important when recovering sexual function. So some of the acupuncture points in the study, just to give you a little overview, some of the functions are to do with releasing some of those neurotransmitters and inducing an ideal microenvironment in lower segments for the nerves to heal, and also regulating some of the efferent information from the internal pelvic organs, and regulating some of the sympathetic pathways for the sex organs and prostate. And again, just a pretty little picture about how acupuncture can regulate some of those afferent and efferent nerves. So just the signals going back and forth, which can stimulate sexual function. So we, in this study, are using sacral points. We're really trying to have a look at potentially whether some of these mechanisms are in place, whether we can restore some of the balance between the excitatory and inhibitory impulses, stimulate some of the brain centers and regenerate some of those nerves, so the cavernous, pudendal, and pelvic nerves, and also just stimulate local blood supply. And we know for nerves to regenerate that there needs to be a growth of axons across the gap site, that we need to be able to sustain the regenerative capacity of some of those neurons, and that the Schwann cells need to remain active to keep those nerve fibers alive. And early studies with electrical stimulation to nerves show that acupuncture or electroacupuncture can achieve these goals with a potential recovery improvement of 30 to 50%. So just touching on, this is not part of my research, but this is just research that is out there for recovery of continence after surgery. There's also evidence with sacral pudendal nerve stimulation being effective, and that perhaps pelvic floor stimulation could increase the urethral closure pressure and stimulate and strengthen muscle contraction of the pelvic floor. So in terms of recovery post-surgery, acupuncture and electroacupuncture, could potentially be quite helpful for recovering erectile function and for urinary incontinence.
So Emma, that's for stress urinary incontinence. Someone asked, could it be useful for urge urinary incontinence or an overactive bladder?
I actually have used electroacupuncture for overactive bladder. And there is research, again, like Judith was saying, there is actually more research in other cancers. And I can't quote you the research now, but I have used it clinically. And there is also devices that are in use as well. So I think it would be worth trying. Yeah. So just moving on, so out of the surgery realm now, into hot flashes, which are particularly bothersome with hormone therapy. And there are some studies, like these were sort of fairly small studies, but with some pretty encouraging results. So acupuncture and electroacupuncture have been used, and with one study showing a 55% improvement after 4 weeks, and a 77% improvement after 7 weeks of hot flushes associated with hormone therapy. I think the interesting thing is that after 8 months, that this improvement was consolidated or held. And there's other studies using ear electroacupuncture, and they're also showing a reduction in hot flushes after 6 weeks using 3 ear acupuncture points. And again, the mechanistic data is quite early, but suffice to say that we think its improvement is due to regulation of the autonomic nervous system. In terms of cancer-related pain, which again Judith touched on, auricular acupuncture has been shown to reduce pain. This is a really interesting protocol, actually, the Battlefield protocol, which is using 5 auricular points on the ear. And the really good thing about this protocol is that these semi-permanent ear acupuncture press needles can be put in by your practitioner. They can stay in for 3 days. They provide rapid relief. There's no side effects, and you can keep them in whilst you're using other medications. You can even, replace them yourself as long as you know where you're putting the needles. But I find auricular acupuncture to be really, really useful. And we get good feedback from patients about this. And I think it's good that they can be left in safely for a couple of days, just extends treatment potential benefit. So there's also some interesting research about dry mouth associated with radiotherapy. And there's a few studies actually. There's one that we use quite regularly, which is the first one here, where it's a combination of acupuncture needles in each ear, so some ear acupuncture, and also in that sequence is acupuncture in the index finger. This was based on a study where 50 patients had 318 treatments. Most had around 5, but some had up to 15 treatments. So all patients had increased flow rate of saliva at the 6-month follow-up, and more treatments were associated with better responses. Importantly, no adverse outcomes. And the recommendation from this study, if showing benefit from this protocol, is to have a 3 to 4 week regimen of weekly acupuncture, and then do a 1 month of maintenance, followed by monthly or bi-monthly visits. There are other studies to do with dry mouth from radiation therapy, and one was a randomized controlled trial with acupuncture versus oral care. And again, this one is quite good because it was 145 patients, but from 7 cancer centers. And again, there was a significant reduction in severity of dry mouth compared to oral care alone. And I thought it was nice also that there was also an improvement in sleep, because patients didn't have to get up and sip fluids. And so that was kind of an added benefit. And again, another sham controlled trial showing benefit, and at the 1 month follow-up. So these patients had acupuncture 3 times a week for the full course of their radiotherapy. Judith also mentioned, and I think this is a really important point with acupuncture, that we can treat several things at one time. And so if you have a symptom cluster of, say, nausea, fatigue, and chemotherapy-induced peripheral neuropathy, we can treat that with acupuncture in one session. So it doesn't have to be, you can only have one symptom treated. It's most common that there will be several things going on at once. So that's one really nice benefit. Not only does acupuncture treat the whole person, but we can treat several symptoms at once. So as I mentioned earlier, prostate cancer and acupuncture and electroacupuncture is emerging. Research is still emerging. We would love, we have a fantastic centre at Chris O'Brien Lifehouse Hospital where we have a great team and we are really integrated, and hopefully this model is going to be emulated at other centres so that more patients have access to these services. And potentially we can have referral points at, say, prostate cancer nurse appointments or referrals from urologists more and more. And with the goal of really, really looking after patients and reducing symptom burden so that you can live well during treatment or after treatment for prostate cancer. So, I'm not sure what's happened to my screen there. Anyway, thank you, Kalli and Dr. Morrison, and I'm really grateful to have spoken. And if you have any questions, feel free to answer. Really happy to answer them.
Thank you so much, Emma. How very interesting. Yeah, it's just something, is that a topic we never hear about, or especially in our traditional medical training. So it's so good to hear what you do, how it all works, where you put those needles. There's a question, what's the difference between dry needling and acupuncture? So the dry needling like the chiropractors and physios use compared to what you do being acupuncture?
That's a really good question. And, dry needling is not, doesn't require the same registration that is required of us as acupuncturists. So we do a 4-year health science degree. Dry needling, you can practice after doing a really short course. There is no diagnostic principles in dry needling. So it's basically finding sore spots or trigger points and putting usually quite large needles into them. It does work. I'm not going to say dry needling doesn't work, because I think it does work, because it is a kind of form of acupuncture. But people who do dry needling are not required to have the same skill as an acupuncturist. So acupuncture is a holistic, you form a diagnosis, you make a treatment plan, and you're really looking at whole person care, whereas dry needling is not like that. It's a very, very simplified version of acupuncture.
I mean, you also can't take the evidence from acupuncture studies that are looking at traditional Chinese medicine-based acupuncture and extrapolate them to dry needling. So if we say acupuncture helps with hot flushes, or acupuncture helps with dry mouth or with pain or erectile dysfunction, it's not the same evidence. So dry needling, that doesn't apply to dry needling. Those studies are looking at traditional Chinese medicine-based acupuncture.
And with the dry needling, would they attach the electricity, the electropuncture that you were talking about? Electroacupuncture? I'm
actually not sure of that. I haven't heard much. I mean, technically they could, but electroacupuncture is really nuanced. It's actually quite a complex intervention, knowing what frequency you're using and what type of waveform you're using, what dose you're giving someone. So if I had a choice to get electroacupuncture, I would be going to an acupuncturist.
Fair enough. Just to remind everyone, this is your very last chance to ask any questions in the Q&A before we close the session. So just post them in there as quickly as you can. A question for either of you. What about oncological massage? Like, how's it different from regular massage? You say your remedial massage. What's the difference?
So oncology massage is practiced by people who have studied oncology massage. So we run It's a 4-part, there are 4 levels of oncology massage specialty. It's practiced by people who have got a massage background and then go on to specialize in really understanding what the main needs are for a cancer patient, how to approach somebody who's on chemotherapy, who may have a low white cell count or a low platelet count, so can bruise easily, people who've got bone disease, and looking at this, it's quite a different technique. It's often a much softer massage, really looking mainly at the fascia level, at that very, it's not that deep, get your elbow in massage. Very therapeutic. The studies again in massage in cancer care are in oncology massage, so people who use these techniques, and quite powerful actually. So in one of our oncology massage therapists runs the teacher training, so it is a process to learn oncology massage, but once you learn it and practice and are safe to work with cancer patients, then it's quite a different massage process.
And
beautiful.
Quick question, Emma, in relation to your work in the acupuncture field, for those that are in other states, are we talking about any acupuncturist can do what you're researching, or is what you're doing unique at the moment to be expanded within the field?
I believe my research is unique, and we're hoping to expand it in the field. We've had, kind of some interest to expand it. We need to get this study done, obviously. But yeah, as far as I know, I'm the only person that's doing this. And so, I'm really hopeful that we can expand, the neuroregenerative sort of aspect of this research with electroacupuncture. But I'm also really excited about expanding out, our knowledge of what's available for patients undergoing other therapies like chemotherapy and radiotherapy and hormone therapy. I think there's so much potential for electroacupuncture and acupuncture to be of benefit to people who've had a prostate cancer diagnosis and who are having a completed treatment. And I also think, in helping our patients, we're also potentially helping families, partners, friends. Prostate cancer can be a little bit of an isolating experience for some, not all, but, so yeah, I really hope that, yes, I think I'm the only person doing it. But yeah, hopefully this will lead to other things. That would be the kind of end goal.
And I just know to be able to publish a protocol, and then people will be able to learn what.
Yes, absolutely. And that would be the goal. The goal is to share. The goal is, if we can find something of benefit, that it would be to share, and for everyone who was interested in doing it to be able to be trained and to be able to do it. Yeah,
and with your research project, are you still looking for people to join?
We are. We've just filled the block that's about to start, actually. So this next block of participants will go through till the end of the year. So they're just about to start in 2 weeks' time. So we're now looking for participants for the following block, which will start in early next year. Yes, most definitely. If there's interest, then happy to speak or be contacted about that.
Right.
A question for Judith about Chinese herbal medicine. Some of them some of the medicines taken in larger doses can affect the kidney function, and you can go into renal failure. How do you work around that, or without trampling on toes? Sort of with the practitioners that prescribe this.
So I would like to, I guess the approach that we have in many integrative oncology services working in comprehensive cancer centres is we're quite conservative when it comes to herbs and supplements in prescribing them. Having said that, there are some really interesting herbs and supplements that can be really beneficial to patients. And in China, where people are receiving Chinese herbal medicine, acupuncture, and comprehensive treatments as standard of care, together, they've done a lot of research looking at the interactions and the safety of certain herbs in certain doses. I work very closely with our pharmacists, and what I do personally is I get a list of the breakdown of all the herbs that are in any formula or that people are being prescribed. I send that to our pharmacist, looking at any interactions with their anti-cancer treatment or other medications they're on, looking also at their kidney function, liver function, their general bloods to make sure there's no risk to those organs, and then coming back with advice and safety for that person. Traditional Chinese medicine, some of the herbs and supplements, it also depends on who's prescribing, how they're prescribed, the dose, and the safety of the sourcing of the products. And that's quite a bit of work is being done in this space. Jun Mao, who's at Memorial Sloan Kettering, is really interested. He's an acupuncturist. He's the head of Integrative Oncology there, and he's looking at the safety of rolling out more use of selected Chinese herbs in cancer care. So that's a long answer to a short question.
No, that's all right. And
With
Judith,
care.
Emma had said that her service is not covered by Medicare. Is yours? I know last time we spoke, you were working on it. Is there any update?
Oh, look, I think there's always a challenge in cancer care. What we're seeing is there's a larger group of people who are living with cancer and living with advanced cancer. And so we're always lobbying government. We went to government, we've written a white paper, we've stood at the door, we've had a parliamentary breakfast, we've been asked to run an ask, but they haven't responded to our ask yet. How do you fund this to get more money? That's the big picture. The small picture is, yes, I'm a doctor and my services are covered by Medicare, often charge a gap fee. Our exercise is covered by limited, but covered by Medicare, as is our lymphedema service and the private funds. And some of our therapies are not, and then we rely very heavily on philanthropic support so that people who can't afford it, in order to provide equity of access, we can provide the care that people need.
Someone's asking, is the Peter Mac facility in Melbourne offering a similar service?
So I work very closely with the director of the Peter Mac service, and we went to government together, Jerry McDonald, who runs the wellness service. They have very limited interventions, but they have some services. So they have oncology massage, and I don't know if they have much else.
Okay. And then finally, before we close, someone said, how can they find out about the resources that have been shared today? Is there a website or just a central repository? We are going to give them access to this recording, so they'll be able to see whatever you've presented there. But any place they can look?
The Society for Integrative Oncology has is a website that has quite a lot of information there. Cancer Choices, that website is for patients to use. So is the Memorial Sloan Kettering About Herbs app, which you can download on your phone. If you're looking at herbs and supplements and their safety with commonly prescribed anti-cancer treatments, you can look up interactions and safety of taking certain supplements, and there's a consumer version versus a professional version. And I guess have an appointment and discuss it. And really, it's all about personalized healthcare, isn't it? And it's really about finding what works for a person. And there's so much I don't know. There's so much to read, and I think we're very fortunate. We've got a great team. I'm just in awe of Emma's presentation. I thought that was very beautiful, and the work she's doing is very elegant, sophisticated research. And I think that's the key, is elegant, sophisticated research moves the field forward.
Fantastic. It's been an absolute pleasure hosting both of you here to hear your expertise and your experience on a field many of us know very little about. So yeah, our brains are filled, and I hope more people are going to be interested in accessing your services. Yeah, I'm going to hand over to Gary for the closing remarks.
Thank you. I am a prostate cancer survivor of 14 odd years. It's just fascinating to sit here and listen to both your presentations today, purely from a perspective. I can remember when I was diagnosed on the first occasion that I went home, did Dr. Google, and there was really nothing around what we're discussed tonight. I always came from the perspective, I am what I eat. And so looking at the whole food scenario was, you know, an incredible journey. And I managed to find a book which came from the Prostate Cancer Foundation in the UK called Healthy Eating, the Prostate Cancer Cookbook. And it provided me with recipes to be able to eat the right foods. I mean, it's all very well to say eat broccoli and that, but how do you make it interesting to? And that's been a lot of the problem, even talking to a lot of the men that we deal with in our group about, you know, you've got to eat healthily. It's about giving them the recipes. And then when you look at for a family situation, if you can eat what dad's eating, it's going to be a good thing. The only problem is I can't find anything in Australia that has a cookbook around our diet, the way Australians eat. And we eat differently to the way the people in the UK and the same in America, where all these cookbooks come from. So that's a passion of mine in the future. But apart from that, look, the information you've given us tonight has just pressed so many buttons, which within our support group, I know they'll take away many, many good hints to be able to look at the integration of how they're going to be able to get wellness back into their lives. You're dealing with a demographic with prostate cancer of men, you know, in their 50s, 60s and 70s, and we're all creatures of habit. And it's very hard to break the mold. So it's a learning curve. I think it'll be interesting to see where we are in another 10 years. To everyone, this fantastic webinar is available on our YouTube channel, and that'll be up within the next 24 hours. And I know it's going to be highly sought after. So on behalf of our sponsors, Boston Scientific and PCFA, on behalf of the Shine Light Support Group, both to you, Judith, and to you, Emma, thank you so much for a wonderful 2 hours.
Oh, it's been
Thank you so much.
Great. We look forward to seeing everyone again on our next webinar. We're juggling up the themes a little bit here, purely because there's new legislation coming in, and we wanted to get the themes as current and as on topic as much as possible. We'll be giving you information on our next one very, very shortly. We will be looking at, I believe a few people had a few problems trying to get into the webinar tonight. We'll look at those issues and we'll come back and rectify those for you. On behalf of everyone, have a good evening and thank you so much for attending.